Now, what are the demands? Well, Republican leaders here in the Senate are holding the debt ceiling hostage so they can end Medicare as we know it. Democrats are trying to protect Medicare and ensure its solvency, and the Affordable Care Act is already doing that. Not only does the Affordable Care Act provide more benefits to Medicare recipients, it also extends the solvency of Medicare by 7 years. That is the conclusion of the most recent report of the Medicare trustees. Now, of course, the first big idea from our friends on the other side of the aisle this Congress was to repeal the Affordable Care Act, and they all voted to do just that. So please understand that one of their first votes this Congress would have had the effect of diminishing the solvency of Medicare, shrinking the solvency of Medicare by 7 years. Not only that, but according to the Congressional Budget Office, the Affordable Care Act will reduce the debt over the next decade by $210 billion, and over the decade following that, by more than $1 trillion. So rather than saving money by making our health care system stronger, making our delivery of care more efficient, and keeping our constituents healthy, Republicans voted to repeal the health reform law. So the big Republican contribution to the sustainability of Medicare and our national debt was to vote to shorten Medicare's life expectancy by 7 years and to add well over $1 trillion to the debt in the next 2 decades. There is no doubt that the biggest threat to the sustainability of our long-term debt is the cost of health care. And that's why so much of the Affordable Care Act is designed to address the cost of the delivery of medical care. Let me give you just a couple of examples. First, the value index. The value index will direct that health care providers be reimbursed by the value of the care that they provide rather than by the volume, the quality of the care rather than the quantity of care. In Minnesota, for instance, we do health care a lot better than most other states. We provide higher quality care at a lower cost than almost any other state. There's room for improvement in Minnesota, of course, as a healthcare economist told me. In Minnesota, we get an A, but that's because we grade on a curve. In Texas, they get reimbursed 50% more per patient in Medicare than we do in Minnesota, and yet we have better outcomes. Why? Well, we have a different healthcare culture. In Minnesota, we tend to do more coordinated, fully integrated care. We tend to see patients as people who we want to keep healthy and out of the hospital. In Texas, patients are more often viewed as profit centers. There are some excellent high-value centers of health care in Texas, such as Baylor University. Then there are some egregiously low-value ones, like many in McAllen, Texas. And by and large, Texas doctors order more procedures than Minnesota doctors so they can bill for more procedures. But the idea here isn't to pit Minnesota against Texas. The idea is to incentivize low-value states to do health care more like high-value states. Imagine if we could bring down the cost of health care in Texas by 1/3 and yet make sure that the people of Texas are healthier. Imagine the savings to Medicare and Medicaid. One more example. Senator Lugar and I wrote a provision into the bill called the Diabetes Prevention Program. It's based on a CDC, Center for Disease Control program, piloted in Indianapolis and St. Paul. They took folks that had been diagnosed with prediabetes and gave them 16 weeks of nutritional training and 16 weeks of physical exercise at the YMCA, all at a cost of about $300 per person. the number of people with prediabetes who later developed full-blown type 2 diabetes was reduced by almost 60%. 60%. Caring for chronic disease is the most expensive piece of our health care system in this country. One of the most common chronic diseases is diabetes. It costs our nation $218 billion a year to treat diabetes. A couple weeks after the Affordable Care Act passed, I brought the Undersecretary of Health and Human Services into my office to meet diabetes experts from the CDC and with United Health Group, the country's largest insurance company. The goal of the meeting was to get HHS on board to bring the piloted diabetes prevention program up to scale nationwide. The executive from United Health said that her company would definitely reimburse their policyholders for going through the 16-week program. She said, you know why? Because for every dollar we spend, we'll save $4. The Value Index and the Diabetes Prevention Program are but two of the many programs in the Affordable Care Act that have been written into the law. Jonathan Gruber, the MIT professor who helped put together the health reform system in Massachusetts when Mitt Romney was governor there, has said of the Affordable Care Act, quote, it's really hard to figure out how to bend the cost curve, but I can't think of a thing to try that they didn't try. You couldn't have done better than they are doing. Since then, in the House, Representative Paul Ryan and the Republicans in Congress have taken an entirely different approach. Instead of putting in the long, hard hours of consulting with health care providers, health care economists, patient groups, hospitals, rural health groups, and medical researchers to actually try to build on protocols that have been proven to bring down the cost of delivering quality medicine, Representative Ryan decided to just slash the funding of Medicare, give the money left over to seniors, and let them fend for themselves to buy their own health care from insurance companies. Now, we know that there was no functional market for health insurance for folks 65 and over before Medicare and Medicaid started in 1965. It's doubtful that there would be one now. Under the Republican plan, seniors would essentially get a voucher for a significantly lower amount than their Medicare is worth now. Remember that the cost to Medicare for administering its program is less than 2%. Insurance companies, on the other hand, spend around 11% just on administration. The CBO estimates that under the Ryan plan, out-of-pocket costs for health care for each senior will more than double to over $12,500 a year. This is not Medicare as we know it. This is not Medicare. So understand this. The Republican plan to end Medicare would make huge cuts in Medicare benefits and put insurance companies in charge of seniors' health care. This would double the out-of-pocket expenses for seniors and toss aside all the new benefits offered by the Affordable Care Act. There is no question which vision of Medicare holds more hope for seniors and which takes a scientific, evidence-based, best practices approach to addressing the long-range cost of delivering health care to all Americans. And yet, my colleagues on the other side of the aisle are telling us that they are willing to risk throwing the global economy into depression if Democrats don't act more responsibly on Medicare. Well, okay, here's an idea. Allow Medicare to negotiate with the pharmaceutical companies on drugs for Medicare Part D. The VA does it, and guess what? The VA pays an average of 48% less than Medicare does for the top 10 most prescribed drugs.